Hello, everybody. Welcome back to another episode of The Root of the Matter. I am your host, Dr. Rachel Carver, and today we have one of my dear friends, colleagues, mentors, you name it, he goes on the list. Dr. Kelly Blodgett, welcome back for a second visit. You were one of my very first guests. We're now in the third season, so I'm really excited, and I appreciate you taking time out of your busy schedule to talk with us today.
It is so my pleasure. I mean, we go back a good 8 years
I
now.
know it's crazy how fast that time has gone, you know?
Yeah,
Dr. Blodgett and I, we both finished the naturopathic degree in 2020, January, right before, the
yeah.
shit hit the fan, right? So we were really, we were really lucky to kind of squeeze it in there. So the reason I wanted to ask Dr. Blodgett back on today is he has just published his new book, Feel Whole Again. So I'm really excited about this. Reading the book, it's a pretty quick read, but I felt like he was, downloading my brain onto the pages. And so, he and I come from a similar background of connecting to people. Yes, we are technically dentists, but we really believe in human behavior and and listening and compassionate care, because you can be the most technically expert dentist there is, or you can be a person who maybe doesn't have the technical skills, but man, you're compassionate and you listen and your patients feel good. And that compassionate dentist is going to have a more successful practice. Because at the end of the day, we are human beings wanting human connection. And, technology, this whole AI, I mean, it is coming at us so fast,
Yeah,
but yet at the expense, right, of human connectedness. We see this in our, the teenagers and the kids today, but we're really seeing it in medicine and
absolutely.
dentistry. It is great. You can really cut your staff costs because you have so many automated things now, but you really lose. I mean, how many of you call the doctor's office and you got to, dole through and you're just sitting there going 00000, just want to talk to a human being, right? Because it's so frustrating, again, trying to have that connect. And I still have my team members call the patients, even though we have an automated reminder system. I still make them call every day. Yes, it wastes a lot of their time. Well, I wouldn't say waste, it
Yeah,
takes some of their time.
yeah,
But to me, that little touch is so valuable, right? And I make them stagger lunch, because during the day when we're in the office, I want somebody to be able to connect to a
yeah,
live human being and not have to leave
absolutely.
a million messages. So why don't we start with, tell us a little bit about why you wanted to write this book and what it's about.
Yeah. So, and thank you for allowing me the opportunity to share about it. Part of my story goes back to college. So I got my degree in psychology and, took the GRE so I could get into grad school and go get a master's and a PhD in psychology. That's what I thought I was supposed to do, or that's what I thought I was going to do with my life. And when I came to Christ as a senior in college, I heard God calling me to become a dentist and reverse the negative stereotype of dentistry. And I remember at like 21 years of age, I'm like, what? Like, why on earth would I have a guy with a degree in psychology become a dentist? And what I put on the pages of this book is the accumulation of 30 years of experience of why there is so much value in understanding people's psychology and their humanism, their emotions, their feelings, the words that they use, their mindset. And it's, as you were just talking about, healthcare having trended so far into the objective, you know I mean, and there's wonderful technologies, of course, right? You can do bioresonance stuff, you can do an in-body scan, you can do blood tests and learn all sorts of things about your DNA. But in my opinion, that's only half of the puzzle. How a person feels, how they communicate. I mean, gosh, you and I as small business owners certainly can appreciate the value of understanding different people's different personalities. And in my opinion, that aspect of our life experiences, like how people think, how they communicate, if we can learn to resonate with each individual person's preferred way of communicating and maybe be the door or window that can open for them to see possibilities, thereby bringing hope rather than hopelessness, which I know you and I see people every week where they are so frustrated with their health experience because it's been so focused on the objective. They might have feelings where they're saying, a classic one, I had this root canal done 3 years ago. It's never felt right. That's yours in my world. And they're saying, look, it's never felt right. And I've noticed these changes in my health, and I suspect it might be this root canal. And what they hear is, no, everything looks fine. It's like completely discarding a person's intuition, their feelings. And so the reason I wrote this book is to help, first and foremost, the human beings which include us, who go to receive healthcare or engage with healthcare providers, to understand and appreciate that there is tremendous values in our intuitive senses. And that in the book, I talk about not using the words need and should, but once in a blue moon, I think it's appropriate to say, like, we should be able to state how we feel and it be received in a way where there's value given to that information. So, and I also wrote it, as you noticed at the end of the book, kind of an ode to healthcare providers, which is a loving wake up. Please understand you're not solving a math equation or an organic chemistry equation here. It's a human being with feelings. So that's why I put it out there.
One of the quotes you had, I think, in the first chapter, right, was listen to the patient. He's telling you the diagnosis. And I find this to be so true. Like, somebody will come in and they have, a hot tooth, and clinically, you don't really see anything wrong. Every time I will look at the patient, I say, what do you think is wrong? Right?
Yeah,
It's like you are living in your body and you are the only one who knows your body the best way, at first the patients would look at me and be like, "What? Like, you want my opinion?" I'm like, "Of course." I'm like, I like in your book, you said, "Listen, I don't know everything. I don't know anything either, but I love to learn. I want to learn. I want to help solve, like your book, you're right, the puzzle pieces. What's the missing, right? What's the missing piece here that we can put back together? Because human beings are complex, with my own struggle and eczema so many years ago. And I, just kept trying to learn and learn and learn. But at the end of the day, I was like, wow, I think, yes, parasites were part of the problem and the stress was part of the problem. But what was all the way at the top was that the thoughts, the emotions, which was causing this imbalance in my nervous system. To me, it's become pretty clear that emotions may be 80 to 90% of chronic illness, right? I talk to my daughter all the time. Listen, thoughts become beliefs, beliefs
yeah,
become reality, right? So if we, like this
yep,
morning, she couldn't go to school. She said she had a migraine. And I was like, okay, giving her all these options to try. Nothing works for me, she said. I said, well, then that's true. I said, "What if you thought, hey, some of these things," I said, "You know how to manifest stuff like crazy." I was like, "What if you started trying to manifest positive things in your life, right?"
yeah,
But again, she believes that nothing's gonna help, and therefore nothing's gonna help, and she's gonna stay feeling really bad, right? Her thought process. So, and another thing that I do in my practice too, on the very first, like, patient work, it's a little bit of values, like, why are you here today? Like, list these 4 things and have one of them is like, I want number 1, I want, the best possible preventative care. And the other one is cost and expense. Right? So, depending on what somebody picks, if somebody picks cost and expense as number 1, it's probably not the right practice for them, right?
yeah,
Because I'm all about whole body care, all
yeah,
these things, and if you're just worried about cost, then you probably wanna go to the Aspen Dental right down the road, although they're getting pretty
sure. At
expensive
least
too,
there's
right?
options.
Yeah,
There's options.
exactly.
Yeah,
So, that right there, it's kinda like what you talk about, that's a starting point of where is this patient coming from? Like, what do they value? Like what you talk about in the book. One of the first question is, what is your goal? Right? Because I love that example you gave in the book. Like, you're typically the dentist comes in, the hygienist has done her thing, and you go, do, 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 do. Yep, we need those 3 fillings. Okay, treatment plan it and send them to the front desk.
Yeah, yeah,
right? And in medicine too, right? Doctors don't have, what do they have, 8 minutes per patient or something? You can't dive into all the nuances and complexity of human behavior and physiology. So that's where we're feeling so disconnected. And I think that's why this movement of not only functional medicine, but biologic dentistry is exploding because people
absolutely.
want answers and they know, right? Inherently, we're trying to get people back to their intuition that something's not right. They just have to find the right doctor who's going to listen. So I think that's really really exciting. There's another thing in your book you talked about. I can't remember if this was a quote or not. Every cell of your body is listening to your thoughts. So just like I said with my daughter, okay, every cell is listening. That nothing she puts in her body, even ibuprofen or prescription, it's not going to work because her cells are, that's what she's telling the cells, right? And so I found in my practice the really tough patients. One, they appear to be socially isolated. These are the people who have a million, chronic issues and nobody can ever fix them. And the biggest one I see is that social isolation, right? They don't have the support or the community around them. Um, and they're feeling, very depressed and lonely. Like this is a huge one that I see in 100% of the patients that you can categorize with these like really serious chronic stuff. And and sometimes, what I did, you have a great new patient practice, right? Like everybody, have one day to do that. I love that. I started doing it a little bit differently because I'd have new patients right in the middle of the day. And those patients, those are the ones you just want to talk to. And with our background, we just want to talk and, like, hey, did you know this and this is connected and all these kind of things. And it was ruining my schedule, right? Because I had to go do this check and then I had another patient waiting for me and it didn't feel authentic to that new
Yeah,
patient, right?
yep.
And so I started, especially patients who would be traveling, started doing Zoom sessions on
Mm,
Fridays. And so I was like 100% dedicated to that patient, no distractions. And that felt, and to see, like, do we resonate with each other? Is this going to be, a good fit? And then they could come into the office and do the clinical stuff. But I think that's important. Like people like us, that's what we're trying to do is understand the human, their thoughts, their beliefs, what they're trying to get out of what is their end goal in the dentistry here. And even
mhm,
though it may have been different, people want to have, healthy teeth, right? But depending on, they want to resonate and feel like I always say, I'm going to partner with you. I'm not going to dictate treatment to you, right? I am your partner. Let's come to this together. I'll give you all the options and the pros and cons, but ultimately it's your body. I had a
yep.
patient just crying the other day because she was so upset. She had two abscessed, teeth. And I was like, everything's gonna be okay. I was like, we have these different options and we're gonna get there. I'm like, it's so upsetting. I 100% get it, but I got you. We're gonna do this together. And I think that's what patients want to know, right? Like you've got their back, you're gonna support them, you're gonna be there through the process.
Well, I think it's knowing, but it's also what you're conveying is a feeling, which is hope,
Yes.
you know, and trust. And the power of those feelings is, you know, it's wise to lend a lot of credence to the power of how we feel.
Hmm. Hmm. Yeah, 100%. Because and again, I like with these younger generations, they're all about feelings, right? In our generation, it was like, put your head down, like, you got a migraine, tough, you're going to school, right? I mean, and now, we're all more about, this feelings and, they teach all this kind of stuff in school now, they have all sorts of acronyms and, it's trying
I
to
need a self-care day.
yes.
Yeah,
And it's like, and we need to balance this. But again, I go back to that thoughts become beliefs and belief become reality. So if
God, it's
people
so
can
true.
understand that, and it's not about, toxic positivity, right? Where you have to feel positive all the time. It's important to, like you talk about in the book, acknowledge your feelings, right? And then you make a decision. Okay, am I going to wallow in these feelings or I'm going to acknowledge them? It stinks, but now I'm going to make the choice to do something different. I'm going to think a little differently so that I can get that reality, that I want, right? So that's part of what you talk about also is empowering patients.
Mhm.
So you have people come in from all over the world to see you. So I love you had some great stories in the book. Maybe tell us some of your favorite stories of people who felt completely hopeless, and then you come and, just again, you're just giving them that hope, not to mention all your expertise.
Yeah, I'm thinking of 2 women, actually. Coincidentally, they both live, like, 15 minutes from each other up in the Seattle area. So it's not we're not next door. It's a 3.5-hour drive for each of them, but they both came in as new patients within a month of each other, and both were suffering from almost like feeling like they didn't want to live anymore, that kind of level of depression. Each individually dealing with very different expressions of oral disease. One gal, chronic smoker, all of her front teeth, like canine to canine, upper and lower teeth are literally flapping in the breeze. She, didn't smile. She hadn't chewed normal food in, probably 20 years. And kind of like what you were just saying about the woman who was in tears, this was the same kind of situation where, my gosh, the amount of tears at her new patient experience visit was immense. And when I started to like diagram for her, this is what's possible for you if you're open to doing the work, which, by the way, doesn't start with your dentistry. It starts with your mindset. It starts with your nutrition. It starts with you quitting smoking. And she was like, oh my gosh, it could look like this and I could feel like this. And, so throughout 2025, we went through this journey of removing all the infection in her head 3 months after I first met her, because I had her work with the functional nutritionist that, I refer to. And it was so awesome. I mean, her healing was so predictable. She cold turkeyed her like 2 packs a day, which sent her for a spin for a month, as you might imagine. But Megan Barnett, my functional nutritionist referral partner, like she just got her on great nutritional protocol, got her gut functioning well, and like boom, 3 months later, we were ready to go. Uh, in December, we were able to put on all of her final prosthetics, her bridges, onto ceramic implants. And when it finally dawned on her, you mean I can take a sandwich and bite through it? You mean I can kiss my husband and not worry about my teeth flapping? I mean, she just, again, the tears, it's just so powerful. You're right. Of course, the clinical aspects for sure, like removing infection, but knowing from the start what is possible when you have the right mindset, the right nutrition, the right support team, which is not
Mhm.
just my team here, it's many people outside of us, even referral practices when she's at home, in Seattle.
Mhm.
Um, and the second gal, interestingly enough, same situation, feeling so sick, like physically felt like she was dying. And sadly, she had gone to a dentist who calls himself biological, but he's just basically extracting root canals,
Mm.
and not cleaning the bone, not ensuring that there's energetic balance. And after she had her root canals removed, she felt so much worse than before.
Mm.
And I mean, she just looked green, horrible. She was like prior to all this stuff, a triathlete, insanely fit, and literally her oral health infection, cavitations, and root canals tanked her health for about 5 years. So she thought, oh, well, I'll just get the root canals taken out up here in Seattle and then I'll go see Dr. Blodgett for the cavitations. It ended up being like we had to open everything back up,
Mm.
clean out all the infected bone and help her to regenerate. But here we are, 8 months later, and she's back to training for triathlons
Amazing.
and has this spirit of gratitude, deep appreciation, confidence in her own health and abilities. I mean, it's been kind of magical to watch her come back to life, Yeah.
I mean,
It's
that's the coolest part of transformation. Like you said, it's when you have a pretty new bridge, whatever. Now your teeth are aligned, whatever. That's great, but the change, the effect that you have on the person's overall well-being is so much more satisfying. Makes me think of when I did the Dawson curriculum, and the very first course they asked everybody, what's your favorite part of dentistry? And probably 90% of them were like, "Oh, when I make somebody's tooth look all pretty and blah, blah, blah." And I was like, "Hmm." I was like, I really like taking teeth out and getting people out of pain. It's really satisfying to see their change in behavior and how grateful they are."
Yeah.
I was like, "Yeah, okay." From the get-go, I always guess I was always a little bit, different.
Well, yes, that's why we are so synergistically along the same
Yeah,
path.
yeah. But what I love that you said, and I want everybody to really think about is, you know, when your oral health is, in kind of disarray, you got a lot of issues, just fixing the mouth does not, fix the problem, right? And it's really important. We talk on this podcast all the time about the real importance of nutrition, right? Diet, nutrition, like that is at the foundation. So much
100%.
of what, in my opinion, gum disease, decay, starts in the gut, right? That inflamed gut, the microbial imbalance, like it's all the same thing. So we can't really um, completely eradicate disease in the mouth if we're not paying attention to that. So, like you said, it's important. You can't just have the dentist. Even if you have a biologic dentist, as knowledgeable as Dr. Blodgett, we can't do everything. Even though we know a lot about stuff, it's like having that support team is so vital, right? And having the people. There's only so many hours in a day, right, that you work. So having that functional nutritionist, having somebody or a health coach, right? Something like that helps you get those. We all know what we should and shouldn't eat, but again, nutrition has to be personalized, right?
Yeah,
The
for sure.
carnivore diet doesn't work for everybody. Vegan doesn't work for everybody. Like you really need somebody who's going to understand you, your lifestyle, your thoughts, your beliefs, all those things to help you get to that place. And then, like you said, you have incredibly predictable dental work. Right? Oftentimes, dental work can fail left and right, sure. Because if we're not, again, considering the whole body, that we have a tongue, we have muscles, right? We have an airway. There's all these things besides just the teeth that we need to consider. How are you sleeping, right? That's going to make a difference. Are you grinding and clenching? And, again, we
Yeah.
have all these kind of band aids. We throw a splint in here and, just fill a cavity. But again, if you really want to have that whole well being, we've got to look at the entire body. So,
Yeah.
and what you made an interesting point too, right? Just because you call yourself biologic, right? You really want to research, your biologic dentist because it's not a specialty. It's more of a philosophy, but there's
Yeah.
so many different, variations. So, it's important to have some questions going in to be able to ask. And first of all, if the dentist isn't willing to talk to you beforehand, that should be your first red flag, right? Or having a team, it doesn't
Yeah.
necessarily have to be the biologist, but making sure that the team, right, that they can answer all your questions. When I first got SMART certified to remove amalgam, I wasn't good about communicating the term SMART to my front office. So somebody called and asked if I was smart, and the front desk was like, "What?" She's like, "Well, then I don't wanna," and I don't blame the patient, right? Like, if the front desk doesn't even know, then, yeah, things probably aren't real organized there, right? So I think it's important to, understand what your goals are, right? And then come up with like a set of questions, and whether it's the team member or the doctor themselves in order to be able to answer them and to feel that, what you want, right? And in my previous podcast, we talked about values and different health pillars. So then putting that together with who do you want on your medical team? On my health and wellness team, I've probably got six or more different practitioners, right? That are referred to for different things. So it would be nice to just have the internist and the internist be able to do everything, but in reality, they're so burnt out and, tired, they, may not have all the capacity to do everything you want to do. So I think again, it is important to have that. And some people say, well, I don't want to do the nutritionist, or I don't have time or money for this, but you're not going to achieve the final goal without all the pieces.
I would agree with that. One thing I want to acknowledge too, because as we're talking about nutrition, and absolutely, I could not agree more that, health starts in the gut. And of course, the mouth is part of the gut. I certainly, I can think of a handful of patients where they were doing, and it seems to be the phrase these days, I was doing all the things, whatever that means. But, typically that means like I am seeing the nutritionist. I mean, I'm doing the detox protocols. I'm, seeing my acupuncturist and blah, 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 blah. They're doing all this stuff. And the final, you know, the needle in the haystack of their health journey is, in fact, their toxic dentistry. And one of the things that it's probably taken me up until the last 2 years to really grab a hold of is that when people are asking me, my goal is I want to experience my best health. And it can be challenging to share this, but it's like, then we have to treat the dental aspects as a whole system. There's no, like, if you have 5 root canals and 4 cavitations, my choice in order to help them is we will do that all in one visit while you're sedated so you're not under stress. But it's like if you went into your oncologist and had, 6 breast lesions, they're not going to tell you, well, how about we take out 2 and see how the other 4 go, right? We will treat this as, the whole system. And I believe, like, and if anybody can go and look at the Google reviews that have been written for my practice in the past 2 years, almost every one of them acknowledges a couple of things. One is the team. They're like, Dr. Blodgett and his team are amazing. And secondly, they acknowledge, like, they were honest with me and explained by treating it all at once was the only path to predictably feel whole again, or something to that akin. Not to bang the drum of my book title. Might as well. And I mean, I have just seen, like, wow, the difference it makes in actually addressing the metals, the dead stuff, and, the bite imbalances. When people are then balanced in a biologic sense and an energetic sense in their mouth, stuff starts turning on. It's like literally sometimes turning a light switch back on. So for those people listening to this that aren't in the dental profession and, are considering some type of biological dental rejuvenation, my encouragement is to appreciate, to have predictable results, you treat it all. Those are the people I have seen, like, get their lives back, not the people who go, well, I'm going to start with, these 2 teeth out of the 12 teeth that are dead, you know, which I think the reason I'm mentioning is that, like, for most of us, this would include me, like, that would be something I would want to plan for. It's not like coming in and, oh, there's a cavity on the cheek side of this tooth. It's going to be $500 to fix it. Most people could fit that into their budget. Oftentimes you're talking somewhere, 50 to $100,000 to rebuild 40, 50 years of, symptomatic management and bring it back to a state of biological health. So just wanted to put that out there.
Yes. No, but it's important. It's interesting what you said. I'm really into the energetic aspect of health and dentistry too. So, we know that a root canal, it's dead, right? There's no nerve, there's no blood supply anymore, and it's like a scar, right? We've stopped, the energy. Then you have dissimilar metals, and that's screwing up the energy. So
Yep.
exactly what you said. You get all that out of there, and suddenly energy can flow again. Like, to me, anytime you have pain, something is stopping energy from flowing properly, right? So is it a microbe? Is it, a scar, whatever? And the thing about dentistry, right, is most of these things are asymptomatic. So this is why, the medical profession, they don't put a lot of credence in dentistry because, one, they just don't know, right? You know, and two, they're not, if you don't have a symptom in the head and neck, they're not looking there, right? So that's
Yeah.
that's the tricky thing. And this is what we talk to, some patients say, well, I don't want x-rays. I'm like, okay, I can't see anything. I've got, so if your goal is, or people, people will say, well, it's too expensive. I'm like, what's more expensive is, you miss something, then you lose the tooth. Now you need an implant. All these things, like, so again, it's like those first conversations when you're meeting something, really trying to understand their values.
Yeah.
Are they worried about radiation? Are they worried about cost? And then again, trying to meet that with what are your ultimate goals? So like you said, really trying to listen to somebody and understand, and being in the dental profession, that can be some of the frustration and actually patients just refusing. But I think that refusal comes from the doctor and team not educating the patient. not listening to what their true needs and values are. Like you said, I mean, in your book, you have examples of people who'd been to a million dentists and, could maybe have had similar treatment plans, but they never felt listened. They didn't understand the value of it. And that's why your degree in psychology, I used to say all the time, oh my God, especially for children, I was like, I need a degree in child psychology, to treat kids. But again, understanding human nature and how, all the different personality types and, how many times did people say, "Oh, I hate the dentist." Nothing against you, doc, but, I hate the dentist, right? So many
Yes,
people come in already with these negative preconceived notions. And so, yes, it takes a little bit more time with these patients, but what we get in return and the patient is so much more valuable when you really have that true connection. And it makes dentistry can be challenging physically, mentally, you know, but when you have those patients who hug you and say, "You changed my life." I had my patient bring me she made this huge, it must be like, I don't know, 11 by 14 picture of pressed flowers. It is the most go I started crying and I was like, oh my god," like, it was just the appreciation for that, and I was like and so I hang it right between my 2 main operatories, so, for some reason in human nature, right, we only remember the bad things, "Oh, that case that didn't, go as planned," or whatever. So when I look at that now every day, I'm like, I'm doing good things, right? Like that just seeing
absolutely.
that things, I'm like, that person appreciated me. Let's focus on, all that good stuff. Cause right, like you say in the book, I'm a human being just like you're a human being. And I may have more
Yeah.
knowledge in this one aspect, than you, but it's still I have the same feelings and thoughts and frustrations and stuff like everybody else. So and that's what I try to do on the podcast, right? I share my struggles. I talk about, my kids and stuff because people wanna know you're real. I think you connect with people like, "Oh, I'm going through the same stuff." I saw an Instagram reel yesterday that made me crack up. It was like a woman, she's like, "I just, I worked all day, then I come home and I cook and I clean and I do the laundry." And I was like, "Oh," I was like, "Yes, okay, it's not just me," you know?
Yeah.
Just feeling that connectedness, like we're all one. And again, then we have the amazing ability to help people, kind of take the next step and get the wellness part of it. And that's the other thing that makes me think of too, like why, insurances will say scaling and root planing, right? The deep gum cleaning. You can only do half the mouth at a time. Like, that just makes no sense.
Oh my
Like,
gosh.
and then it has to be like 2 weeks apart. I'm like, who came up with this arbitrary thing? Because I'm like, okay, so the other side's going to be all totally reinfected again. I was like, if we can get a patient to do it all at once, we're going to do it all at once. Like you said, it makes no sense.
Well, in my opinion, I always like to start with that. In my opinion, the entire aspect of insurance participation, it's a farce.
It is.
It's all a lie. Like I'll be talking to a hygienist later today, and one of the questions I want to ask her is, why do you think that dental recare visits are set for every 6 months? Like, is it that every human being actually has identically the same cleaning needs? I mean, are you kidding me? But You know, and to your point, like, that's absolutely insane. You have like, let's say your appendix has burst. Well, sorry, your insurance says we can only do the anterior portion of your appendix this week. We're gonna have to come back next week to clean out the posterior. It's like, that's insanity. It's the same system, and we allow it.
Yeah. Well, those of us that's why so many of we're like, "We're done. We're out of insurance," because it is just and that's, frustrating, and sure, so biologic dentistry can be more expensive, but again, what is your ultimate goal? How much money are you gonna spend having these chronic ailments? I mean, because it's spread out over time, maybe you don't see those, but it's 10 times the cost of really taking care of someone,
Totally.
you know?
Yeah, I would argue that biological dentistry is might you spend more money per procedure on the front end, but have such a greater degree of health that you actually not only feel better and experience fewer symptoms, but you spend way less money over time.
Yes.
you know?
And you
I
may be
had a
able to
guy.
work longer, right? And you may live longer, but work
Absolutely.
longer, you have more potential for earnings, but where you're not, every day having to call into work because some ailment. So I think that's really true, and trying to have people really understand that. So like you said, in a biological, it's not necessarily every 6 months. It's like, what does this person
Right.
need? Because that again, we
Yeah.
are all different. We all may be humans, but we have so many different variations, just like with diets, right? Certain diets work for some, not
Yeah.
for other. Like you really, that's another big thing we do in biological is individualize treatment to that person, right? And so for
Yes.
years, we would always try to come up with like these hygiene protocols, and it never worked because, we had all these flow charts, and I'm like, it just doesn't work, right? We have ideas, right? And we have all these different modalities, like in biologic dentistry, our toolbox is enormous, but it always has to be, and that's why our hygiene patients are an hour to an hour and a half, even for a routine recare, because maybe that patient needs laser. We got to look under the microscope. How's it going? Do we need to do a saliva test? All these kind of things, and then also having the time to talk to them. Where are you at?
Right. Yeah, how you doing?
Yeah,
How are things progressing? What's worked? What's been a challenge?
yeah.
Absolutely.
I've
Yeah,
really
it's
had to
funny.
turn my brain off. I'll be going, and sometimes I'm so busy, and I'm going in, and I had to stop myself and be like, "How are you?" Because sometimes I just rotch in and go right into the mouth, and I'm like, "That's terrible," right? Like,
Yeah, you gotta switch out of the
yes,
the
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 busy
fix it
mode.
mode, right?
Yes.
Well, it's funny, like when other dentists come and visit and they take a look at our quote unquote hygiene schedule, in our software, they'll notice that almost the entire day is open. And they're like, you're paying them to be there to not do anything? I'm like, they're doing things. But because of our new patient day on Mondays, what it allows for them to do is be available to take care of the whatever we've decided would be most appropriate for those people that week while they're here.
Yeah.
And or they'll be reviewing information from somebody who's in Tallahassee or something. You know what I mean? Like, these are smart individuals. Clearly there's got to be greater value to a dental hygienist and their deep knowledge of oral health and systemic body wellness than just scraping teeth. So my hygiene, I have two hygienists that work for me now, and like, that's their favorite part of the job is using their brain,
Yeah.
being a participant.
Yeah. I hired a new hygienist, and she's absolutely amazing, and she's really interested, in the health and wellness and the biologic, and so right from the get-go, and she's still young and, like, hungry, right? So she she came into the practice, I'm like, "Okay, you gotta get your laser certification, alright, you gotta get your anesthesia license, and you're signed up for the functional nutrition health coaching curriculum," which she already finished in
Great,
2 months. And she's like,
great.
"Wow, like, this is so amazing." And I was like, "Well, because 'cause we're training you. You are not just, the gum polisher, right? The tooth
Yeah,
polisher. Like,
yeah.
you are the health coach in this office." I have another hygienist who went through Morley Robbins' whole root cause protocol. So she's been putting a lot of our patients with hair mineral tests, right? We had a new patient the other day, and she was young. She's like, "I'm really healthy," but she had pockets of 6, 7, 8 millimeters. And so I start asking, I'm like, because she said there was nothing on the health history. I'm like, "Have you ever had acid reflux?" "But yeah." I'm like, "Okay, how are your bowels?" But a lot of times people don't think to, like, my dentist doesn't need to know that, right? Even though, you're going to a, integrative dentist. And so I had to ask these questions. I'm like, "Absolutely. You think you're healthy because you're young, but now we're seeing a result of, something's not right in the gut." And I was like, "Do you want to keep these teeth your whole life?" "Absolutely." I was like, "Well, then we need to figure out why you've got an autoimmune reaction happening and your body's eating away all your bone." And she's like, "Oh," and so she's like, "Okay, let's do the hair test right now." Right, right. So it's a really nice tool just to start with, because to me, at the foundation is our minerals, right? If those are all out of whack, then all of our systems, right? And are there heavy metals, right? You'll see that on that test too. So that's been really cool for the hygienists, because now, and some of my other hygienists now, they were a traditional hygienist for most of their career, and they've come into my practice now, and they're learning, and it's really really cool to see conventionally trained practitioners open their minds. and be like,
Mm,
whoa, there's so much more I can do for this person versus just getting tartar off their teeth.
yeah.
I think it's really cool to see that in my patients that really, and again, these women who've been doing this for over 30 years, and now suddenly I'm like, you got to think differently if you're going to work here. So
Yeah.
that's
Well, that's
cool.
it's funny because the last golly, well, about the time I hired Mara, who was one of our classmates
Yeah.
at the naturopathic program. I think for the last 12 years, the only hygienists I've hired were those who just got out of school. And I mean, it's just, I mean, whether it was Providence or dumb luck or whatever, interestingly enough, I'm just like you in the process of hiring an associate dentist. I just had the guy out here 2 weeks ago and he's finishing his senior year in dental school. And I'm so thrilled because I mean, I've talked to dentists who've only, they've only been out of school a year, but they know things now, right? And not only that, but they've been tainted by what it feels like to come out, be put in a high volume situation where yes, it's stressful and you're not really doing anything meaningful, but you're making good money
Mhm.
and it's like, boy, it's hard to divorce yourself like I did in residency, where it's like you're going to make $18,000 for the whole year. Like you're basically not even able to pay rent with this, but you're going to learn a ton.
Mhm.
And, obviously it takes a person, any person, whether they're seasoned or brand new, it takes a spirit of openness and humility that we don't know squat
Right.
about this new human being that we're meeting today. To your point, we know a lot about a few things, but we don't know anything about this human being. They're brand new to us. So I find that those of us who have pursued this approach, we understand in our hearts that, the role is to be open and to be of service and to be humble. And that's a wonderful spirit through which you can partner with somebody
Yeah.
and help them get back to health.
Absolutely. With the as we're just kind of wrapping up here, when at the kind of end of the book, I like the you talk about the principles of the humanistic approach, right? So one was like honoring honoring the truth, right? Honoring their feeling, right? Trusting intuition. Yes. I think so much we've lost that ability to trust ourselves, but it's really important to find the right practitioner who's gonna listen to what you feel is true, right? Value the connection, right? We've been talking all about that. It's so important to feel, we get very vulnerable when we're ill and, and our whole mental state is shattered a lot of the time. And we just want to feel supported and connected and, you know, finding people like that, I think if you're looking for that in dentistry, look towards the biologic, go to the
Mm.
iabdm.org, look, that's where you're going to find these people who are, have this philosophy and are trained that way. But then number 4, you were always like, we got to eliminate the toxicity, right? So we can talk happy feelings and we can change our thoughts and stuff like that, but we still have to get rid of the toxic stuff. It's amazing what kind of microbes, I mean, not just bacteria, but fungus, parasites, time. All of these things sit in dead jawbone. They sit around these root canals. A root canal is a dead organ, right? And now, interestingly, what I find too is I think every single root canal you pull out, you're going to find microbes, right? They may vary because it's something that is dead. How I think the other important thing is that there has to be some prep work sometimes too. Like you said, you have referrals, you have your functional nutritionist, health coach, whoever it may be, get you prepared for these surgeries because sometimes you can have these surgeries and the cavitation never really heals. And that's because the
Oh yeah.
work wasn't done. If your elimination organs, right, aren't draining, your body doesn't know how to detox. Like there has to be that prep work so that once that's removed, now your lymph can clear the rest of it. But if you're all cloggy and you're eating the wrong things and you're still, your liver is just completely messed up, you're not going to get the best results. So that prep work, just want to tell people that, like, that's really important that you have that other team member to help you get clean, like you said, and then you get super predictable results.
Well, and if I may add to that, and thank you, that's beautifully acknowledged. I think that the work that Dr. Dominic Nischwitz has done through his biodentistry global standard, looking at nutrition and appreciating that going into surgery is not a passive endeavor. You're asking your body to go through a significant reparative process.
Mhm.
We know, like, if we want to have best results going to the gym, working out, getting our body fit, we're going to eat a specific way so that our body has, all the bits and pieces it needs to grow and heal. And really, I would say through working with him, I've come to appreciate, man, yeah, I've got to be more direct with people, or it would benefit my patients to be more direct about, let's acknowledge that you're moving into a phase where your body has to be able to build back. And you know if anybody wants to look up providers like us who acknowledge that, yes, nutrition, how we're feeding ourselves to prepare for this kind of biological dental journey matters, his biodental global standard is a really good resource.
Great. Yeah, we'll definitely list that in the show notes for everybody. So then the last
Thanks.
two principles you talked about was embracing the energy. So again, we talked a little bit about that, the energy, right? Is that the right one I'm saying? Embrace the energy? And then commit to growth, right? I love that. Like you said, like I don't know everything. We don't need to go to continuing education. We already know a lot. Our businesses can thrive, but that's not who we are, right? We're always seeking to help learn as much as we can for ourselves, right? We better ourselves so that we can better our patients' experiences. And I think that's how we've gotten as far as we have. We love to learn. There's a reason. Greater being, whatever you believe in per se, has given us all kind of a path, and our path is to commit to that growth and meet people where they're at and help them have that same ability, to have good energy and to grow. Again, I thought your book was great. Um, you know,
Thank you.
where can people buy Feel Whole Again?
Yeah, thanks. They can go to Amazon and pick up either the ebook or the paperback or the hardback. Yeah, check it out. As I think you're absolutely right. I mean, I wrote it intentionally to be a streamlined read. I mean, this isn't like oh, it's going to take me 2 months to finish this. In a afternoon or two, you can easily get through it. I think the stories will resonate with people. Yeah, I encourage
I
people
know,
to
like,
get a copy and check it out.
absolutely. I think the stories are some of the strongest parts of the book because you see yourself in a lot of these different stories. And I know when I started storytelling, when I got that eczema, that's what changed my whole practice and my whole thinking and brought me into where I am today. And I think as much as a horrible pain that was my wake up call. That was the universe pointing me in the right direction. And so as I was learning and going through healing phase or whatever, sharing those stories, people would resonate that, or you tell stories about other patients and how they got better, like, that feels more genuine and authentic than saying, "This is just the way it is. You've got an abscess, well, root canal," right?
Right.
Like, how people got better, so I think that's very exciting, so well, I know you're a busy man. Is there anything else you would love to leave the audience with today? Any more words of wisdom? And definitely then tell us how we can connect with you on social and your
Sure.
office.
Well, thank you to you and to all people who take the time to listen to this. And I guess some parting thoughts is, never underestimate the power that your own belief system has in your life experience. Simultaneously, also don't underestimate how any change made in your mouth when you're visiting a dentist can impact your health, either for good or for bad. The mouth is an integral part to our entire body and life experience. It is so foolish to think that we can make changes and it doesn't change our body. It's literally a change to our body. So I'm so grateful that, you and I and the hundreds of other dentists who are choosing to think more broadly, and acknowledging, not just acknowledging, but also pursuing learning so that we can better be of service to our patients so they can experience better health. It's very inspiring. I know you and I have been on this journey of biological approach for over a decade, and it's so cool to see more and more dentists getting excited and their teams getting excited about this approach. People are welcome to go to my website, blodgettdentalcare.com. For any dental people who are interested in the coaching services that I provide to teams, they can go to my personal website. It's drkellyjblodgett.com, drkellyjblodgett.com. And there are some different options on there where, I come out to people's offices for 2 days with with one of my two of my team members, and we help people solve problems in their dental practices, or reshift or shift thinking processes that maybe we got taught in dental school that don't serve the best interests of their patients and their practices any longer. So I'm really excited about the coaching I'm doing with teams these days. I've seen real life practice elevation and spirit elevation for the dentists who have been working so hard, finally getting to see the patients getting healthier, their businesses doing better, their family life getting better. So it's really exciting to be, you know, pursuing that new aspect of my career as well.
I love it. I think, that's one of my favorite things to do too is, just talking with others and letting them see there's another way. We don't all have to
Yeah.
be we don't all have to burn out, We just need to kind of live in our values, find that authenticity and find a different way to practice that's so much more fulfilling, but doesn't have to be, feel like you're on the treadmill, right, all the time.
Amen.
Well, thank you, sir. It was always a pleasure seeing you, and I look forward to seeing you at our meetings coming up.
Yeah,
For taking the morning,
absolutely.
and yeah, I'll see you in person real soon. So I hope you all enjoyed this episode. Please leave us any comments or questions. Share it with anybody you think might be interested, and we'll catch you on the next episode. Have a great day, everyone. Huge thanks to you, our amazing listeners, for helping us climb into the top 5% of podcasts in the oral health space. With all the love and support, we've been getting many requests for one-on-one consultations. So we made it happen. Are you ready to take your oral health to the next level? Click the link in the show notes to book your personalized consultation, and let's kickstart your journey to a healthier, brighter smile starting today. We'll see you then.